Did you know that 88% of cardiac arrests happen at home? That's 4 out of every 5 arrests happening to someone you love. A child, a spouse, a parent, or even a friend. Will you be part of the 70% that doesn't know how to help? Today I will show you how to do the various steps when it comes to performing CPR. I have always tried to stay on top of the ever-changing policies when it comes to it, to keeping up to date with my card. I want the audience to know how to provide CPR if it ever comes down to a life or death situation. Did you know that immediate CPR can double or even triple a victim's chance of survival? According to the American Heart Association's website. In this speech, I will teach you what CPR is, how to use your 4 C's, the various steps when performing CPR, and the different ways one can perform CPR based upon your training. What is CPR? CPR stands for cardiopulmonary resuscitation. It is a first aid technique to prevent someone from going into sudden cardiac arrest, preventing brain damage, or any other medical emergency. There are 2 main goals that standard CPR wants to accomplish. Keep oxygen flowing in and out of the lungs, and keep oxygenated blood from flowing throughout the body. Since you know what CPR is and why it is used, you can now learn how to perform CPR on an individual. When coming into contact with someone who is unconscious, the first step you need to take is to check the scene, the first of the 4 C's. You must first check to see if the scene is safe. You don't want to walk into an unsafe scene where you could get hurt. Count to 5 as you wait to make sure the scene stays safe. Then you walk over to the victim. You want to tap the individual on the shoulder or gently shake them. Call out to them and ask them, "Are you okay?" For the purpose of this speech, let's say the person does not respond. The next thing you should do is to call for help, the second of the 4 C's. You have a nearby person call 911. Give the person as much information as possible and specifically point to an individual and say, "Call 911, he or she is unconscious." If there is no one around to get help, call 911 yourself. Now that you have called for help, you can tend to the victim. The next step is to check the victim for signs of life, the 3rd C. You must open the victim's airway. Tilt the victim's head back with one hand, with your other hand lift the chin. Check for signs of life by placing your ear over the person's mouth. Listen for breathing and watch for chest movement for no more than 10 seconds. It is important not to perform CPR on someone who does not need it. If the individual is already breathing, you can cause further damage. Now that you have checked the person, let's talk about how to give CPR. There are a few different ways you can go about performing CPR based on your training level. If you are not trained or are a bit rusty, the American Heart Association suggests that you do uninterrupted chest compressions at a rate of approximately 100 compressions a minute until emergency personnel arrive. If you are confident in your CPR skills, you should perform CPR in the following way. The last C in the 4 C's stands for caring for the victim. This is when to perform CPR using the CAB method, the CAB method. C stands for compressions. Place one hand over the other and fold the fingers down. Push down in the middle of the chest approximately 2 inches deep 30 times quickly. A stands for airways. Look into the victim's mouth to make sure there is no foreign objects. If there is anything in the mouth, take your finger and hook it out. The B stands for breaths. Form a seal over the victim's mouth so no air can escape with your mouth. Give 2 slow breaths, approximately 1 second each, to make the victim's chest clearly rise. You should continue the cycle of 30 compressions and 2 slow breaths without stopping. There are only 5 reasons as to why you should no longer continue giving CPR. 1 is if the person begins to breathe on their own, if the paramedics arrive to the scene, if you become too tired and are unable to perform CPR any longer, if an AED becomes available for use, and the last one is if the scene becomes unsafe. In conclusion, I have told you about the various ways someone can perform CPR to save one's life based upon their training. the steps to take when performing CPR, and how to check the scene, call for help, check the victim, and care for the individual, the 4 C's of CPR, and what CPR stands for. With this information, you have the knowledge to save a life in a dire situation. Since most cardiac arrests happen in our own home, you could be saving your loved one's life just by knowing these few simple steps of performing CPR. You could be someone's hero.